As you prepare for your licensure exam, it's important to understand the key distinctions between adjustment disorder and major depressive disorder. Although these conditions can present with overlapping symptoms, recognizing their differences is crucial for accurate diagnosis and effective treatment planning. In this section, we'll explore the essential features that set them apart. By clarifying these concepts, you'll be better equipped to approach exam questions and real-world scenarios with confidence. Let's begin by examining what makes each disorder unique and why these distinctions matter in clinical practice. Adjustment disorder is defined in the DSM by a set of criteria that revolve around the presence of emotional or behavioral symptoms following a clear, identifiable stressor. These symptoms must arise within 3 months of the stressful event and are considered out of proportion when the reaction is noticeably more intense than what would typically be expected in response to the situation. It's important to note that the distress or impairment must be directly linked to the specific event, rather than stemming from ongoing or unrelated issues. The symptoms should not persist for more than 6 months after the stressor or its consequences have ended. Paying close attention to these timeframes and the connection to a particular stressor is essential for accurate diagnosis. Major depressive disorder, or MDD, is a clinical condition defined by specific criteria outlined in the DSM. To meet the diagnosis, an individual must experience at least 5 symptoms, such as persistent sadness, loss of interest, changes in appetite or sleep, and difficulty concentrating. These symptoms must be present nearly every day for a minimum of 2 weeks. Importantly, MDD is distinguished from ordinary sadness or a temporary low mood after a difficult event. Unlike feeling down for a few days, MDD involves a deeper and more prolonged impact on daily functioning and overall well-being. Now, let's take a moment to examine where adjustment disorder and major depressive disorder share common ground. Both conditions can disrupt your sleep patterns, affect your appetite, and alter your overall mood. These symptoms can significantly interfere with daily functioning, making it challenging to carry out routine activities. Recognizing these overlaps is important, especially when preparing for exams, as it helps prevent confusion between the two diagnoses. Understanding these similarities ensures a clearer approach when distinguishing between them in clinical scenarios. At this stage, it's important to focus on the crucial distinctions between the two conditions. First, consider the role of a stressor. One may be triggered by a specific event, while the other could arise from a broader range of experiences. Next, look at the duration of symptoms. Some disorders persist for weeks, while others may last much longer. Severity is another key factor, as some cases involve mild disruptions, whereas others can significantly impact daily functioning. Understanding these differences not only clarifies the concepts, but also equips you to answer exam questions with confidence. Consider Sarah, who recently experienced a significant job change. Shortly after, she began feeling overwhelmed, anxious, and had difficulty sleeping. These symptoms developed within 3 months of the stressful event and were clearly linked to her adjustment to the new work environment. According to the DSM criteria, Sarah's distress is out of proportion to the impact of the job change, but does not meet the threshold for a more severe mental health condition like major depressive disorder. Her symptoms are directly tied to the identifiable stressor and are expected to resolve as she adapts. This makes her case a textbook example of adjustment disorder, rather than a more chronic or severe diagnosis. Let's examine why Sarah's situation aligns with adjustment disorder rather than major depressive disorder. First, the onset of her symptoms closely follows a specific stressor, which is a hallmark of adjustment disorder. Her emotional and behavioral changes appeared within 3 months of a significant life event, and these symptoms are directly tied to that stressor. Unlike major depressive disorder, where symptoms persist independently of external events and often last longer, Sarah's distress is proportionate to her circumstances and tends to resolve as she adapts. The pattern and duration of her symptoms, along with their clear connection to the triggering event, make adjustment disorder the more accurate diagnosis in her case. Now, let's turn our attention to Michael, A client who exhibits clear signs of major depressive disorder. We'll examine the specific symptoms he experiences, such as persistent sadness, loss of interest in activities, and noticeable changes in sleep and appetite. These symptoms have a profound impact on his daily functioning, affecting his relationships, work performance, and overall quality of life. Michael's case serves as a textbook example of MDD, making it particularly relevant for your exam preparation. By understanding his presentation, you'll gain insight into how this disorder manifests and why accurate diagnosis is essential.